everybody. In the previous video, we had seen how to write, homeopathic approach. Now, in this video, we will take an example and we'll see that how the homeopathic approach for bronchial asthma is to be written. You'll remember we had seen in the video like initially how to start with initially whichever condition is being given to you, we have to write the proper part or little bit an introduction about the condition given. So as we are discussing here about asthma, we are going to write the little introductory part about asthma. And what does it comprise of? Now I told you a little bit comprising of little bit in the definition, a small intro or few lines on the pathology and the symptoms and the important symptoms of that condition. Now here we see that asthma is a respiratory disorder characterized by cough, wheezing, shortness of breath. There occurs narrowing of the airways along with swelling, which causes excess mucus production, leading to difficulty. Asthma can be caused due to various triggers like respiratory infection, physical activity, allergy to certain substance, certain medications, stress, etc. So, in short, I have given the introductory part about asthma. What we saw is after writing the general introductory part about the asthma, we will write the how to handle or manage the patient asthmatic patient with homeopathy. So what advantages homeopathy has on asthma? How now we've described here a few points like now asthma can interfere with daily activities and can lead to a life threatening asthmatic attack. Homeopathy is a holistic form of treatment where one does not need different medicines to treat various manifestations of asthma. That is, unlike the conventional, medicines, conventional treatment, we don't give homeopathy is a holistic treatment. So every different symptom doesn't has a different medicine. We take into consideration the entire, disease picture of the patient, and we give the medicine to the patient. Homeopathy plays a major role in management of asthma in both acute and chronic phases. So that is, both in acute and chronic phases or chronic attacks of asthma, chronic cases of asthma, homeopathy can be very well given. The treatment of asthma focuses on bringing down the intensity, frequency, and duration of attack. So, once you administer the homeopathic medicine to the particular individual, what is expected? We expect that the intensity, the frequency of the attack should reduce down. We are going to write is that homeopathic treatment it aims at increasing the disease free period and minimize the use of chemical drugs. It helps to reduce the use on or dependency on inhalers. So when we administer homeopathic medicines, what we saw in the previous slide is we want to increase the disease free period of that patient. उसके acute attacks हमें कम करने हैं, and as the acute attacks of the patient goes on reducing, his dependency on inhalers also goes on reducing. Then other advantage is that we have seen in the causative factors that stress is another factor that can trigger asthmatic attacks, and we very well know the conventional medicine doesn't take into consideration the stress events. Okay, but here in homeopathy we all know that while taking into consideration or while looking out for a medicine for that particular case, we do take into consideration the mental picture of the patient. So that's an advantage of homeopathy. Then, secondly, what we can do is with homeopathic medicines, the hypersensitive nature of the immune system can be reduced. Thus, gradually cure by proper homeopathic treatment can be obtained. That is, we all know that asthma can be caused due to certain medications or allergy to certain substances like pollen grains, animal dander, certain preservatives. So definitely we have to advise the patient not to take those substances to which the patient is allergic. But eventually the hypersensitive nature of that immune system can be definitely reduced down. Then lastly, the acute asthmatic complaints can be controlled effectively and instantly by the homeopathic treatment along with nebulization. So there is a myth that homeopathy is very good for chronic cases and not for acute ones. So that's not right. Even for acute attacks of asthma, homeopathy can be very well given. So this is in general about, you have to, about the scope, or rather the advantages of homeopathy in cases of asthma, or how are you going to deal with the patient. If an asthmatic patient comes to you, how are you going to deal with that patient? This is what you're going to look for when you given, when you'll take the complete drug picture of the patient, sorry, complete picture of the patient, that is complete case taking, and you come to a remedy, what you expect that remedy to work. This is what is expected. Then, after the writing the homeopathic part, we will be writing the remedies for asthma. Okay, I told you for this you'll refer specially बोरिक. अगर आप पीछे के पार्ट ऑफ बोरिक देखें तो उसमें आपको मिलेंगे रेमेडीज फॉर अस्थमा एंड various other indications are given, like कौन सा typical type है, pain है, aggravation है, amelioration factor है. So you all can just go on writing it. If in case they have asked you, like describe the homeopathic approach for bronchial asthma and mention any two indications of any two remedies or four remedies, then you all write the indication of the remedies. Okay, but if not, then you can mention the remedies for asthma in this way, in short. List, पहले आप list of remedies कुछ दो, and then you can write few lines, or few characteristic points about that remedy. Now, I have indicated it like Sambucus nigra is useful for childhood asthma. Natrum sulph is good for remedy, which for asthma which occurs after 30s or due to the period of stress. Then medurinum is valuable when asthma combines with eczema. Tuberculinum is useful to build up immune system and to prevent recurrent respiratory infection. So just go through the boric and just see what you can what is given under those. For अभी अगर respiratory के बारे में आपको लिखना है तो you all go in the respiratory system, you will see asthmatic attacks. Okay, वहाँ पे एक general list of remedies दिए गए होंगे, and below you will find lot many other common indications or factors like ailments from aggravation, amelioration. So you all have to write that. And secondly, again I'm repeating it, अगर आपको indication of any drug पूछा गया है, then you'll have to write the indication of that drugs. Then lastly, as I had mentioned, what we'll end up with is to understanding or writing the limitations of homeopathy. Now, in cases of asthma, what is the limitation? The limitation is that we cannot, play with the life of the patient in case when the patient is suffering from status asthmaticus. What is status asthmaticus? It is a condition where it is a severe attack. It is a severe attack of asthma where the patient is, very much gasping for air, and we need to admit the patient to ICU, and he needs to be kept on ventilator. So in such cases we have to understand that to save the life of the patient, let him finish the first line of treatment, and then we can think about giving in homeopathic medicine. So this is how you actually deal with an homeopathic patient ना. एक केस ऑफ अस्थमा को हम इसी तरह अप्रोच करेंगे when we are talking in part of homeopathy. Okay, this is all, or how you have to write about homeopathic approach. Let any other condition, अगर कैंसर पूछा जाए तो आप कैंसर के पेशेंट को होम्योपैथिकली क्या क्या देखोगे, what you will expect that should get better. Okay, this अगर IBS लिखोगे तो उसके बारे में लिखना है. So as the conditions come, you all have to write the approach for that homeopathic medicine. This is just an example. Hope आपको समझा है. If there is any difficulty, please contact me and start writing approaches for various conditions, because I'll tell you all, uh, approach is nothing but it's all about your writing skills and learning and understanding. Okay, so refer various books, refer various sites. Homeopathic approach for various conditions have been given very nicely on the internet. on the various sites. So just go through the various sites, you update your knowledge also about it, and then it will be easy for you all to write it. For writing the remedies, I again tell you all, refer books like Samuel Lilienthal, Borek, and N.M. Chaudhary. However, if you have to just write the list of remedies as we did here, as we have seen here, then in that case you'll refer Borek. That's a good thing. Now the PDF file or the complete note of this topic has been given on your note section on your website. So please refer through it. And if any difficulties, please contact me again.